What did Vanna say when I asked her, what is the difference between spit up and vomit? She said, oh no, I'm so sorry to hear that you're dealing with this. Understanding the difference between spit up and vomit can definitely help ease some worries. Here's a quick breakdown. Spit up, 1, typically a small amount of milk that comes back up after a feeding. 2, generally occurs in infants and is caused by overfeeding or swallowing air. 3, it usually doesn't happen with any distress and is considered quite common. All right, vomit then. 1, this is a forceful expulsion of stomach contents and often occurs due to illness or irritation. 2, vomiting might be accompanied by distress or fussiness and can happen with or without nausea. 3, the contents may also include other things like stomach bile and may have a different appearance or odor compared to spit up. And then she asked me, is there any specific concerns you're facing regarding spit up or vomit? For example, has your baby been experiencing a lot of either? I'd love to help you with more tailored information. Just asked her, my baby is experiencing what you would categorize as vomiting after many feeds. What should I do next? And Vanna said, I'm really sorry to hear that your baby is experiencing vomiting. That can be quite concerning. It's important to approach this carefully. Before we get into potential actions, I have a few questions to better understand the situation. 1, frequency. How often is your baby vomiting after feed? Is it happening after every feed or just occasionally? 2, signs of distress. Is your baby showing signs of distress, discomfort, or any other symptoms like diarrhea, fever, or lethargy? And then 3, feeding methods. Are you breastfeeding, formula feeding, or both? Additionally, is the baby spitting up or vomiting after a specific type of food? Say my baby is vomiting 3 to 4 times per day, about an hour after the feed. Does show some discomfort. And then I'm also going to say to her third question, feeding methods, I am breastfeeding. Do notice that the vomit may happen after certain meals. She says, that sounds really tough for both you and your little one. I'm here to help you navigate this situation. Based on what you shared, frequency, vomiting 3 to 4 times a day can definitely be concerning, especially if it's accompanied by discomfort. The fact that your baby shows discomfort when vomiting is an important note. Feeding patterns, notice that it may happen after certain meals is also relevant. Here are a few considerations you might explore. Identify triggers. Are there specific foods you've noticed that correlate with the vomiting episodes? Keeping a food diary may help us pinpoint potential triggers in your diet. 2, positioning. Ensure that your baby remains upright during feed and sometime after the feed. This can help reduce the likelihood of vomiting. And 3, consult a provider. It sounds like your baby may benefit from a checkup to rule out any underlying issues. Your provider can offer tailored advice. The last piece that she mentions is hydration, which is really important if you're dealing with a kiddo who's vomiting. Monitor your baby's hydration. If vomiting persists, it's important to ensure they stay hydrated. You can dig in even further. Let's talk more about the symptoms and what specific foods might be triggers. Or let's look at a food log and see if we can parse out which foods are the most likely issues here. You can keep on going and have these conversations and be able to parse out what exactly is it that we're navigating and what are the best potential next steps for me.